I'm a member of the New York State Nurses Association. I'm also involved and an activist in Occupy the Bronx. I guess I want to start by saying that, the patients and healthcare workers in this borough really can't take any more cuts. It's not really a question of, it's not really an option for me, my coworkers, and my patients, as I see it. I don't see how that's actually going to play out. We can talk about efficiency, and like I think the previous speaker just said, nobody's against efficiency, but on whose back is that efficiency garnered? Is it lowering the living standards of workers and community members in the Bronx? Is it lowering the standard of care? I think the brother who spoke first, I think, said it best. It was a small line, but he said the system is full, and I really feel that every day. The HHC is full, and I think that the plans that are in place, the layoff plans, the privatization plans, are only going to make that more so, and that's my real worry. I think this sort of idea that, and I think it's a very arrogant assumption actually, that and a wrong-headed assumption that we can do more with less, because I don't think that ever happens. I think that may happen for a brief time, that may happen in small cases, but I think as a general method that you always get less with less, and that is when you don't respect the needs of the healthcare workers in the system, when you don't respect the needs of the patients, I think you will always get less with what you put in. And I don't think people can continue to provide such a standard of care if that's been happening for very long, if they're continuing to live and work in these circumstances. I think the idea that we have to do more with less doesn't, when you look around, that doesn't apply to other institutions in our society. You don't see Goldman Sachs doing more with less. You don't see Chase Bank doing more with less. You don't see other Wall Street institutions doing more with less. In fact, they're doing more with more. They're doing more with our tax money. They're doing more with the redistribution of wealth in our society, going from the poorest people to the richest people. And I think that's a major problem that we have to address. That's obviously not, I'm not saying that HHC is in a position to make all these sweeping changes. But what I am saying is these are the crux of the problem. And I think that there's a number of issues. I think at Jacoby, you can see it when I walk in the work every day. You see a couple of construction projects aimed at beautification of our facilities. I'm all for beautification, but when we opened our Building 8 clinics last year, very, very nice facilities, people coming in, blah, blah, blah. Very, very nice, good, I'm happy. But I'm still getting 30, 40 patients from our walk-in clinic into my pediatric emergency room. But all the doctors, the doctors are funded to see sick patients. That doesn't make any sense to me. It doesn't make any sense that we're spending millions of dollars making our hospitals look prettier, and like there's the inpatient pharmacy we just found out that isn't accepting insurance anymore. It's a brand new building, a brand new facility that just got remodeled. Is now only accepting a fee scale in our pharmacy. So I think that there's examples where all of the changes are a lot of window dressing. There's a lot of form and no content. And I think that's a major issue. And I think privatization is a very good example of that. The idea that that's a solution for our budget crisis. I think that what that always means, where does these savings come from, and how do these new entities make a profit because they're now for-profit services? How do they make a profit and also deliver the same quote-unquote patient care and also pay their workers a good wage? Something has to give. And so I'd like to find out more where that is. If people have any answers to that, I have my suspicions. But I think that clearly, as we've seen in our economic crisis in the last couple of years, free market solutions aren't the most effective ones. And I think that's a lesson we need to all take to heart. 3,700 layoffs planned over 4 or 5 years. Again, the system is full. We can't continue to do this to the patients and the healthcare workers in the Bronx. Last but not least, are the contract for the nurses that I work with. It's a basic question of healthcare provision and the morale of the workforce. You can't deliver the kind of quality patient care that we're continuing to deliver every year, day upon day, and continue to be disrespected in such a way. Everybody in the Bronx should have what we have. And as long as we are undermining the last remnants of the stable working class in this country, then it's all downhill from here. And I'd just like to wrap up by saying, again, in the interest of not ending on a depressing note, I think people here should know, both in the panel and in the audience, that there's a couple new sheriffs in town this last year. First of all, I'd like to say that, I think the way in which we can fight against these budget cuts, the way in which we can fight against some of the privatization and the layoffs and things like that, is the Occupy Wall Street movement. The corporations have their corporate lobbyists, and that's the reason why our tax structure is this way. If our tax structure was like it was in the 1950s, we wouldn't have a budget crisis right now. We need a movement. We need a movement to make that happen. We need a movement to fight for more tax cuts, more taxes on the rich.
Add to the Bronx reigning title of highest average rate in the country. I am also one of those folks who make too much money to apply for low-cost health care and not enough to afford $400 a month for your average health insurance. As a result, I cross my fingers and hope I never get sick. I buy asthma inhaler refills from neighbors to stay afloat, and yes, I end up in your emergency rooms if it gets too bad to withstand with a bill so outrageous that I can't pay. I went online to look at the 82 redesigned proposals for Medicaid out of who knows how many that were actually made public. More cuts, more prior authorization controls and systematic measures, which makes a lot of what you report today seem like double talk. A claustrophobic system in place continues to constrict, and healthcare services look like my lungs on a bad day, no inhaler in sight. Meanwhile, private health insurance companies and pharmaceutical companies are breathing easy. These entities have driven a wedge between doctor and patient. The image of doctor as healer in the village fades and becomes replaced with the image of cherry-picking doctor as profiteer or pharmaceutical drug pusher. Mr. Aviles, you justify outsourced labor, which means slave labor behind closed doors. Nurses and all hospital workers to align themselves with the community they serve to strip these private health insurance companies and pharmaceutical companies of their monopolized power over us. We are a village, this 99% you keep hearing about.
Anybody that wants a copy, I have copies here, I think I gave most people. But I just want you to hear what Cornell has to say about the Occupy movement and why it's so powerful and why so many people have been swept up in this movement. So he starts off the article, we the people in the global Occupy movement embody and enact a deep democratic awakening with genuine joy and fierce determination. Our movement, leaderless and leaderful, is a soulful expression of our moral outrage at the ugly corporate greed that pushes our society and world to the brink of catastrophe. We are aware that our actions have inaugurated a radical enlightenment in a moment of undeniable distrust and disgust with the oligarchic economics, corrupt politicians, arbitrary rule of law, and corporate media weapons of mass distraction. And we intend to sustain our momentum by nurturing our bonds of trust, fortifying our bodies, hearts, and minds, and sticking together through powerful hard work in order to create a better world through a deep democratic revolution. And I want to say, people ask it, everybody has conversations, we talk about Occupy. Well, what's it about? And basically it's about, it's democracy, stupid. That's what it's about. It's not about money. It's not about anything more than democracy. That's why the people from the Bronx are in this movement. That's why I got involved. That's why thousands of people across this country have gotten around this movement. It's about democracy. And what we see here today is an outdated model of what democracy is. Having a hearing once a year is outdated. This is a shell of democracy. And I don't want to discard you guys, but we have to get with the times. We're in a dying economy, in a dying future in terms of this model that we built this country on. Unless we change drastically the way forward and make things more democratic and get the people of the Bronx involved, get the people of this country involved, we're going to lose this fight. There are forces out here in the world that are stepping on us every day, economically, in every which way possible. I was in Southeast Asia. We are losing. We're not going anywhere. And unless we switch up the way we're organizing our people, right, and the way we look at our problems ahead of us, we're not going to go anywhere. We're going to constantly fight amongst each other, talk about this one has the money, this one has this, and this and that. And we're never going to get to the point where we truly deal with the problems that we're dealing with within our society. All I'm saying is that we have so much human potential within our organization, in HHC, in the Department of Education, in the Bronx. We have to use them in a democratic way and bring their voice into the process. That's what this movement is about. You have thousands of nurses and employees within your HHC corporation that are not being tapped into. That can work with you and we can build this movement. What most people are afraid of in the hierarchy is that it's going to get out of control. We can't control that anymore if we start giving them democratic levers of power. And you know something? Even give it to them, well, we're all going down on the Titanic. Because this is not going anywhere. We're in a period of austerity that's not getting better. You're talking about billions and billions of dollars year after year being cut. It's not going anywhere unless we change the framework. We have to give some of this power back to the people, or else we will have nothing ahead of us. Our children will have no future. We will have no pensions left. We have to do something different. And this is what the Occupy movement